Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Mohammed Umer Waris. He's a family physician. Today's KevinMD article is titled Regulating Social Media's Effects on Mental Health. Mohammed, welcome back to the show.
Thank you so much, Dr. Poe. It's a pleasure and an honor.
So, Mohammed's been on the show in the past. Go to kevinmd.com/podcast. Go to the search icon, upper right-hand corner. You could look for his last episode to hear his story. But today, let's jump right into your most recent KevinMD article, Regulating Social Media's Effects on Mental Health. How did this article come together?
Thank you, Dr. Poe. How this article came together was similar to my last conversation that we had. There's a preponderance, a barrage of headlines, public health headlines, news bulletins related to the historic decline in U.S. life expectancy to the lowest point that it has been since the 1990s and the largest drop in 100 years that we're seeing, and the first time in our history, such a decline. That related and going alongside of the decline in pediatric life expectancy, children life expectancy for the first time in our history. And what does that say? And it had me thinking, what does that tell us about the health of our society when our most precious population are no longer as healthy as previous generations? And all of this going alongside the rise in drug overdose deaths, the rise in suicide deaths, the rise in the loneliness epidemic, and all of this obviously happening in the backdrop of the increased social media use, technology use, and the effect that is having on youth mental health. This has become such a large public health issue that the Surgeon General just in April released two public health advisories on these topics, one related to the loneliness epidemic and the other relating to social media and youth mental health. And to put it into perspective, the other times that the Surgeon General has released public health advisory, it has been on such issues of importance as the obesity epidemic, cigarette use, HIV/AIDS epidemic, so on and so forth. So that has been the magnitude of the crises that public health advisories have been released to address in the past. And now they are released with a similar idea, with a similar message of elevating the discourse and making this a public health issue, which is the loneliness epidemic and social media and youth mental health. Regarding social media and youth mental health, which was the topic of my article here, the evidence that he presented was astounding in that article, and it was a collection of the latest evidence on why this is now a crisis and what needs to be done. That, for example, one of the evidence noted that just more than 3 hours a day of adolescents using social media, it was increased the risk of depression and anxiety by double. And just by reducing it by 30 minutes a day among adolescents and children, you had a decrease in depression and anxiety just as much as if the patients were doing psychological interventions as self-help and self-help therapy and interviewing and counseling, so on and so forth. And then this goes on for other conditions as well, such as body image concerns, such as ADHD, such as loneliness. I wanted to also bring up the fact that in my own article, I mentioned this, that Facebook's own internal research came out finding that their algorithms were exacerbating youth mental health and body image concerns. And this was only brought to the public's attention when the whistleblower of that evidence that Facebook had, but it was only brought to public attention through whistleblower testimony in Congress. And then other evidence of the fact that increased social media use and technology use was linked to finding brain changes in children and people similar to brain changes found in those with substance abuse and other addictions. And this is what Dr. Ann Lamke means, who's an addiction specialist at Stanford, one of their addiction clinic leads. This is what she means, that our cell phones are now the new hypodermic needles of our time when we're talking about addiction and the brain changes. And then, of course, when you're thinking about these neurologic changes, it's no surprise that increased frequency of technology use is now linked to nearly double the odds of ADHD.
Hmm.
And this is even before we talk about what it is doing to our social connections, to our sense of community, which I'm sure we will get to in the course of this conversation. That now 95% of people, particularly children that are using social media, report having difficulty reducing their use or cutting their use down entirely. That's 95%. And then it's no therefore a surprise that we have, as you have increased social media use, you're also having the increased odds of social isolation reported by these same people. When we then take even a further step back, we know, as the Surgeon General's report had elucidated upon earlier in his loneliness epidemic, that right now we're having this loneliness and social connection crisis where all the major markers of social connection have been declined. You talk about companionship, you talk about engagement with friends, family, all of them have been in decline. And the major inflection points in all of those markers had been noted in and around 2012 and 2013,
Sure.
just around the same time as social media and technology and smartphones, so on and so forth, became more prevalent, more prominent in our daily lives. And we're seeing these declines. So to sum it all up, Dr. Poe, that the Surgeon General's evidence, as well as all the major public health headlines and bodies, are now putting forth that this is a public health crisis, that increased social media use, increased technology use has been linked to the rise in all sorts of mental health conditions, depression, anxiety, body image, ADHD, so on and so forth, loneliness. And we have to take a step forward, both as clinicians, as policymakers, as members of our community, to address this. Because if we do not get a hold of it soon enough, we may be facing a crisis even larger than we are the one in at this moment.
What is it about social media platforms that makes them so addictive and habit forming and consume so much of our teens' times?
That's a very good, fair question, and it might get to the bottom of why we have such a crisis at this time. We know that social media companies and technology and these technology companies, they deliberately design their tools, their products in a way to maximize user engagement, to keep user eyes as long and as firmly upon their products as possible. That is essentially their business model, as you can imagine, not too far off to see that.
Mm-hmm.
And in that, the latest marketing and the latest psychological research is employed. Research, by the way, that is often not done transparently and that is not available to the public to know and see. So that research with what is then designed in the form of, for example, the constant notifications that we get, the infinite scrolling that we have on our devices, the content that is presented in short morsels, short, compelling morsels that quickly switches over to the next, and you find yourself scrolling, not knowing how much time you have spent and what exactly you have even done by the end of it. These are all some of the tools that they employ, and this is not even to mention all of them, just a few of those examples. And why, hence, I think, as I mentioned earlier, it is so difficult for some people, particularly children, 95% of them saying hard for them to cut down on their social media use, on their technology use. And this is particularly concerning, Dr. Poe, because in our young children, in adolescence, when their brains are developing, these changes are happening at times of crucial brain development. And of course, we know the resilience of young brains is strong. So there's strong hope that as you take preventative measures, as you take protective measures, those brain changes can be reversed. But nonetheless, the risk is there. And if action is not taken soon enough, the harm that can be done may be indelible. And so that is what the Surgeon General also mentioned. So much of the research mentioned that the addictive potential of this, going alongside the mental health concerns, but also healthy brain maturation, is now at risk from the increased use and the design of these products.
Now, tell us what we can do as individual physicians. We're both primary care doctors. You're a family physician, so you definitely see more teenagers than I do as an internal medicine physician. But we're just individuals, and we're competing against the might of billion-dollar tech conglomerates whose very products are designed to be habit forming and addictive. And let's be honest, they're going to have much more influence than we have 15 minutes in the exam room with each of these patients. So what do you do as a family physician to help combat this phenomenon?
Dr. Poe, I have made it one of the essential points of my counseling with patients, particularly after the Surgeon General reports came out, the public health advisories came out, presenting the magnitude of this challenge. Part of the counseling, and I do this for both teenagers, I do this for children, I do this for adults, is mentioning how important social connection is to our well-being. And when I mention social connection, I'm not talking about the virtual connections. I'm not talking about the profile pics and the likes and the dislikes on social media. I'm talking about the real meaningful connections in person and how important it is to foster those connections, to cherish those connections, because they are tied to our well-being. And I mentioned to them that loneliness, whether it's recognized or not recognized by us, loneliness in all its form has been linked to an increased rate of mortality just as much as smoking 15 cigarettes per day.
Wow.
That's the latest research on this. And I mentioned to them that we should try to make sure that as a part of addressing loneliness, as a part of building social connection, we need to make sure, particularly for our young people, that social media use should be cut down to a minimum of 2 hours per day. That we need to make sure that family time and dinner times are entirely cell phone and technology free. And that includes even television, that those are technology free times where your phone and your television are off and away. Bedtimes, the phone is turned off 1 hour before bedtime and is kept away from the bed as well. And this is for the general population, and this is for teenagers. But when we get into even the younger populations, children younger than 12 years old, I advise, and the latest research advise, cutting it down to even less than 2 hours or even less than that, to having no technology and social media time. And if you are doing it, making sure that it is reputable, educational based resources that are being provided to the child. And that is because the risk to the youngest of our children is even higher than it is for our teenagers, given at those young ages, brain development is happening at even a more rapid and a crucial time for them. That's just some of the counseling that I do. And I mentioned to them, and this is borrowing once again from the words of other family physicians, leading family physicians and addiction medicine specialists, that nothing can do for your health, no medication can do for your health what exercise and good company and good friendships in person can do for you. And I make sure that that is a strong part of all my counseling with all of my patients and part of my well child exam, well child visits with all children as well. Make that a part of my counseling. The other steps that I think we need to be taking strongly as physicians outside of the clinic is being involved in policy making, involved in advocacy efforts through our organized medical societies, but not just limited to them as well, in our communities as well. We know, as you mentioned, that these companies carry enormous influence, and hence so much of how they have designed their products has thus far not been regulated, and the research for it has just been starting to become available. And the surprising fact to it all is that they have their own internal research that is not provided to the public, that is not provided to independent researchers, that we still do not even know the full extent of how damaging some of these products can be. And an example of that is, had it not been for the whistleblower from Facebook, we would have not had that internal research from Facebook available. So part of our advocacy must involve, as physicians, and standing on the grounds of public health, of children and adolescent health, standing and pointing to the backdrop of this declining life expectancy related to this declining mental health, for us as physicians to now say that this research should be publicly available for researchers, independent researchers, to evaluate and then draw their conclusions on that, if it is safe or not safe, and have those advisories then put in place for those products before they are in the hands of children. And additionally, let me add to this, and this was mentioned in the Surgeon General's report, given enough evidence that we have now that we are seeing the extent of the harm being done, we must also now look at applying the same safety first standard to these social media products that we apply to toy makers when they introduce toys, or to drug companies before they introduce drugs into the market, where the safety first standard and the regulatory bodies test independently their safety upon the health of the general public before they are allowed and put forth for mass consumption. That, I think, has to be a baseline regulatory stance that we need to take, because again, these products are more widely available than even many drugs and toys are.
Yeah.
And hence their extent of their reach and the extent of their effect on our mental health is that much more urgent and essential, and the regulation for that being that much more essential and urgent as well. And I wanted to just point out, to put it in as stark terms as possible, the Surgeon General's advisory put forth this statement, painting in very ominous terms, but very clear terms, the challenge that we face, when he wrote, "Our children have become unknowing participants in a decades-long experiment of social media and technology use. Lack of access and lack of transparency from technology companies have been barriers to understanding the full scope and the scale of the impact of social media on mental health and well-being." That part where he mentions that our children have become unknowing participants in a decades-long experiment needs to be emphasized, that we cannot let this experiment go on any longer without some intervention, some oversight, because the health of our children and our health in general as the public and as a country is at stake.
Now, when you give this advice to teens and their families, what kind of pushback, if any, do you get from them? Because I have two teenage daughters, and implementing some of the suggestions that you make sometimes is easier said than done. Now, for those parents listening to you here, any tips for them in terms of how they could implement some of your suggestions?
Great question. Great question. I think we should begin with pointing, as we have throughout the course of this discussion, the urgency of this, that we are now advised by the Surgeon General and by many other leading health regulatory bodies, public health bodies, to counsel patients just as we would, and children just as we would, as we are counseling them about drug use, physical activity, so on, and other such healthy behaviors. Social media use is now of that same importance based on all of the latest evidence we've gotten. So I think it begins with sharing clearly the harm that can be done and why we are doing this counseling. Secondly, yes, there are many resources, including by the American Academy of Pediatrics, on their advisory page that points to how parents and children can be having these conversations, including a toolkit and including a kit where they have resources on what constitutes good social media use and how to have these conversations. So I advise parents to avail themselves of those resources. They have the social media use plans and a tip sheet for adolescents. And those I many times print out and give to the parents themselves in the rooms to take with them and have these conversations. And at their next visit, bring that with them to see what was done and have this be an ongoing conversation. As we've talked about, this is not going to be an easy or a quick fix, knowing how hard it is already for people on their own to bring down their use. But if we make it an ongoing conversation where we follow up with them on this, perhaps that repeated instruction and discussion can lead to some changes. Additionally, I point to the children, again, the magnitude and the harm that can be done to them. And honestly, Dr. Poe, I mentioned it to them in the larger context of, hey, just as we counsel you on other unhealthy behaviors, because we know in the long term, this affects your well-being and this affects your success as an adult in the future. I'm counseling you in the same light on this, that this is tied to your well-being and success. So that is in that grain, with that mindset that I present these resources, that counseling, and then have ongoing discussions about it with them. And hopefully, and I have seen it, they come back and they have shown improvements and recognition that this is a challenge and talking about it with their own peers about it as well. And I've been pleasantly surprised by when I've had follow-up discussions upon this with others, with the children and the parents, that they have come back reporting, by and large, good results and good changes.
We're talking to Mohammed Umer Waris. He's a family physician. His KevinMD article is titled Regulating Social Media's Effects on Mental Health. Mohammed, tell us some of your take-home messages that you want to leave with the KevinMD audience.
My take-home message would be this for the audience. Let us value our social connections. And as I closed in my other articles, we must choose community, real and meaningful, not virtual and artificial, as our path forward in our response towards this. This social media and youth mental health and technology crisis, this loneliness epidemic that we are facing, cannot be addressed simply in the clinics. It cannot be addressed simply with any simple prescription and pills. There is no substitute for human connection. Speaking upon that, emphasizing that, and fostering that in our own lives, encouraging our patients to do it when we are seeing them in the clinics, and then doing that our own selves outside of the clinics, being the models of the healthy behaviors that we are talking about and seeing the need for, being a model for that in our larger communities as citizens, as fellow family members, as parents, being a model of that in our own lives as well. The Surgeon General's report closed in his loneliness epidemic, where he wrote, a fraying of the social fabric can be seen more broadly in society. Trust in each other and major institutions is in a near historical low. Obviously, we're seeing the manifestations of that on all levels of society, in all sorts of sociological, political phenomena, which we don't have the time to go into here, but we're seeing that. But for us as clinicians concerned about the public health, we are certainly seeing it in the health of our patients, the effect of that on the health of our patients. It's up to us now as physicians and as everyday citizens to make sure that we are engaging in fostering connections and building that social infrastructure that fosters that connection in our lives, whether that is community events, whether that is volunteer organizations, whether that is even faith-based organizations, places that people have gone to for centuries, for millennia, for all throughout human history, for meaning and connection. And we are facing a crisis in that. Social media use, technology use is just a part of that problem that we need to address. But the larger problem and the larger crisis is the one of connection and meaning. And I hope we can make that a priority in each of our lives and make those connections and those institution building for those connections a priority in each of our lives, because the health of our children and ourselves is the one at stake at this moment.
Mohammed, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
My pleasure. Thank you, Dr. Poe, for everything you do.